Today I'm joined by Raven Cole, who is a midwife at Ascension St. Vincent, and we're talking about all the questions that you get from prospective parents leading up to labor and delivery. They're seeing a lot of things on TikTok, they're talking with their friends, and they've got a lot of questions about this process. So we hope to get you some answers today. Raven, thanks so much for joining us.
Yes, absolutely. Thank you.
So let's just start with the big one, with this social media thing, because this is where a lot of the questions that are coming to you originate from.
Absolutely. So we always get patients coming in, whether they've read or heard something on TikTok, through family members, or just anywhere. And, I always welcome it. I love for patients to feel empowered and educated. And so we just ask that you bring those questions and those concerns to your appointments, and let's talk through them together. Let's find out if this is really true or accurate. Does it fit your pregnancy and current state and condition? Or is it just something that's completely false and, we need to come up with a different plan, or just kind of like explain or talk through that?
Are there any things out there that you want to get the word out to people, like do this or don't worry about that would be most common, that is like a safety or concern of yours?
Yeah, I absolutely encourage write these questions down. Write questions down, bring them to your appointment, talk through with your provider and care team. And when you are looking for that provider when it comes to your pregnancy, make sure that you're looking to find out, like, do they have the things that align with my goals and ideas and beliefs for this pregnancy? So, search online, look at those providers, come in at that first visit ready to ask all your questions.
Yeah. What about taking medications during pregnancy? Especially, we were talking earlier about mental health. And there's, a concern about managing mental health and medications during pregnancy.
Yes, that is always a huge one too. Naturally, women are going to be fearful or concerned about what medications they're taking during their pregnancy and what effect this may have on their baby or their pregnancy. One of our biggest goals that we are trying to tackle is treating mental health in pregnancy. Studies have shown taking medications and treating the mom is going to give a better outcome for both healthy mom and healthy baby. If you can't be and feel at your best, how are you able to provide the best for your baby? We have a lot of well-studied medications during pregnancy that we know are both safe during pregnancy and breastfeeding. And so we're able to both treat that mom and still safely care for that baby.
I would imagine another big concern would just be the actual labor and pain and pain management. What are some of the questions that you get in those areas, and what are some of the options?
Yes, so a lot of people want to know exactly what are my options for pain relief. And that comes with a large answer. We have, epidurals, which will help numb and take away those contraction pains. There's IV pain medication. We have hydrotherapy, whether that's utilizing a birthing tub or in the shower. We encourage movement. Labor is active, so get up and move, and that's perfectly fine and okay. We have birthing balls, we have peanut balls, all kinds of things available to kind of help and encourage that. Wireless monitoring. You can get up, move, walk the halls, move about your room, all while still being safely cared for and monitored.
Well, and these labor positions, this is kind of a newer thing, isn't it, to be in a traditional hospital?
Absolutely. So we're really excited that we can still provide a lot of the things that families are looking for when considering birth in a hospital or outside. We have squat bars that can attach to the bed. So even if you have an epidural or something like that, we're still able to utilize that movement. You can get in a squatting position using the bar. We have all of those tools there and present, the birthing balls, anything that you need.
What are we seeing as far as combination between, the care team of a midwife and an OB and maybe a doula? I mean, what are some of those combinations that are newer options now?
Yes, and so you may find that a lot of hospitals, including ours, are moving towards expanding that care team to more than just having your OB physicians present. We have a team of certified nurse midwives as well. We have in-house pediatric care. We have our experienced labor and delivery nurses. We also utilize women's health nurse practitioner in the office. We have our in-house anesthesia and our expert maternal fetal medicine doctors that we have access to consult and also help care for those higher risk patients as well.
And the difference between an OB and a midwife?
So
Their roles at that delivery time.
Yes, and so a midwife, we are essentially advanced practice nurses, like nurse practitioners, but we're also trained for deliveries and for caring for women in birth, postpartum, and beyond, even GYN care. And so the great thing with us is we specialize in those kind of lower interventions, more just natural and letting the physiologic process work. But we also are working alongside our OB physicians to where if certain things arise in that pregnancy that kind of escalate that level, they're right there to come in and help and assist as needed.
Yeah. Things like maybe the baby's position or preeclampsia or something like that.
Absolutely, yes. Preeclampsia, if baby is not in a favorable position, maybe baby is breech and they need what we call a version, where the OB physician is able to turn and rotate the baby. Or if there's just a position that necessitates a cesarean section, then they're there and present for that as well.
Yeah. What are you seeing as far as trends on two things? I'm curious. Nursing after and C-sections. Are C-sections up or down? And is nursing up or down? What are you seeing?
Nursing as far as breastfeeding?
Mm-hmm.
I would say breastfeeding rates are increasing. A lot of women feel more prepared and encouraged to breastfeed. We also provide lactation support. We have a lactation nurse who comes and can help and assist with the patients for breastfeeding, as well as our labor and delivery nurses are also trained to provide that help and assist. And we provide our patients with outpatient resources and places that they can get breastfeeding help and support as well, even after discharge.
And the C-sections, what are you seeing there?
I would say our C-section rates are decreasing. We are working hard towards lowering those rates, and part of that is utilizing midwives. We love to go in and get patients moving and turning and just trying different things to see if we can get towards that more successful vaginal delivery. Mm-hmm. So I think that is a great addition to a care team, is to have that extra support through your use of midwives.
Unfortunately, in Indiana, our infant mortality rates are among the higher in the nation, and is a concerted effort to get those numbers down. What are the key elements for prospective parents to make sure they're not part of that statistic?
Yes, very good question. I think part of the key elements in that is patients feeling empowered to ask questions and not feel that they're not sure why something went on or what's going on. So asking those questions, listening to our patients. We take every concern seriously because we know that different conditions can present in different ways for different people. And so we like to make sure that patients know signs of concerning things to look for, like signs of preeclampsia or having elevated blood pressure, signs of heart concerns, breathing, shortness of breath, different warning signs. We try to go through those at each visit, letting them know, like, these would be reasons that I would want you to call. These would be reasons to, try these steps first. And so I just encourage every patient to just never hesitate to reach out and ask, come in to be seen, and make sure you're choosing the right support team for your pregnancy.
What happens at these prenatal care visits? Why are they so important? And why do we not want to just show up at the ER on delivery day?
Yes, absolutely. So having prenatal care is important because it's our way of, number one, providing that education and preparation for this journey and your labor, as well as being able to hopefully identify and catch things early on. When we don't have prenatal care, we kind of risk the opportunity of potentially not knowing and being prepared for something and kind of finding out in the moment at delivery. And so prenatal care is huge in helping to prevent that, whether that's through Getting the genetic testing earlier on that can help identify any issues. Parents getting a carrier screen to find out if they personally are carriers for any conditions. Through use of ultrasounds, that can also help identify any potential fetal anomalies or risk or things like that.
When people come in and they do a tour and they do this nurse navigation visit, and you're kind of planning that, at what period of time are you recommending that? And then what are the types of questions? What do you hope that the parents are learning in that visit? What should they be looking for?
Yes, so currently we generally encourage our patients to schedule that nurse navigation visit and tour anywhere between 32 to 36 weeks. That gives them the opportunity to come up to labor and delivery. They'll have a nurse who will provide that tour for them, show them the patient rooms, all of the things that those have to offer. They show them where the OR is in case that's needed, where the birthing tub is located. They also have an opportunity to go ahead and start completing some of that paperwork that you usually have to fill out when you come in. So some of that portion is already done. And then we just encourage them to ask any questions that they may have in regards to when it's time for them to come in and labor. So whether that's, what does this look like for my partner and where do they sleep? Or, do we have a place to keep food or drinks cold? And is there a place to maybe warm something up should we need it? What type of things does your hospital provide for me versus what type of things should I pack and make sure I have with me in my hospital bag? And if you have any birth plan, making sure that the nursing staff and everyone is aware too, and that we're able to accommodate those things that you are looking for.
Overall, I would imagine the goal is that for people not to be fearful coming
Correct.
Into this process.
Correct, yes. This should be one of the most exciting times for you. And so we definitely want to remove any sense of fear or worry in any way possible. And so a lot of times that is done through being able to see the area and see that it's not necessarily scary or like your typical hospital room or stay. We try to create as much of a home-like environment as we can and want you to ask all the questions.
Yeah, and when you get the answers, then you feel empowered
Exactly.
and in control as much as we can be.
Mm-hmm.
At least we've done our homework, right?
Correct.
We're ready. We ask the questions.
Yes. Birth and labor is one of the most exciting but also overwhelming times. And we definitely recognize and realize that. And so our goal is to just try to provide all of the answers, create a safe environment for you while still practicing, that evidence-based care and safety as much as possible, but also being able to tailor to your individualized needs.
Yeah. So, and you have 3 children.
I do.
Was your labor different for all of them, or did you kind of fall into a pattern?
I would say each one of mine were still a little bit different, and that's kind of the funny thing, you can have one pregnancy and labor go one way and the next time it just completely throws you for a loop.
Yeah. Did you feel like you wanted to have a tour and do something like this even though you were an experienced mom for your second or third children?
I would say definitely with my first, because I went into it, knowing nothing. But following that, I feel like I was lucky in the fact that I felt empowered and knowledgeable moving forward to where I didn't necessarily need the tour, but still lots of questions. And, and that can be different too, like if you're delivering at a different facility from a previous one. Now this is not necessarily I'm new to pregnancy, but I'm new to this location, and what is this experience going to look like?
Right. Well, Raven, thank you so much for sharing your expertise and insight with us, and I hope that people take some steps so that they don't have this fear, but they do feel empowered for this exciting journey as they grow their families.
Absolutely. Thank you.
Yeah, thank you.